My name is David Warner. I'm a professor of anesthesiology at Mayo Clinic, and we're going to be discussing our paper entitled Attention Deficit Hyperactivity Disorder After Early Exposure to Procedures Requiring General Anesthesia, which will appear in the February issue of the Mayo Clinic Proceedings. I'm a pediatric anesthesiologist, so I make my living by anesthetizing children for surgical procedures. I was sitting literally in the lounge one day with some of my colleagues who are also pediatric anesthesiologists, and we were discussing a recent paper that had come out looking at the effects of exposing animals early in life to anesthetics, the effects of that on neural development. And this and other papers had found that if you expose these animals at the right stage of development, that you can see some histologic changes in the brain that also translate into behavioral problems later in development. Now, we were very skeptical about these papers. There's a long history of, especially in the field of neural development, results that were found in animals that did not translate into children. And we were pediatric anesthesiologists. We put kids to sleep every day. They wake up, they go home, they seem to be fine. There just couldn't be any possibility that this was real. So we were thinking, how can we disprove this finding that was found in animals? Well, I had known about some work that other Mayo Clinic investigators had done looking at the epidemiology of learning disorders and behavioral disorders in the Olmsted County population. This work takes advantage of the fact that we do have access to the medical records of all Olmsted County residents, the county in which Mayo Clinic is located. They also did some work working with the school system to look at the educational records of residents of Olmsted County. And what they did was they took all children that were born from 1976 to 1982. They looked at, from that group, those children who were still resident in Olmsted County at age 5 and who enrolled in school. They looked at all the educational records, public school, private school, parochial school, homeschool, from ages 5 through 19. And they applied research criteria to look at developmental disorders, including learning disabilities, autism, and attention deficit hyperactivity disorder, ADHD. And they published a very nice series of papers that defined the epidemiology of these disorders in a general population. Well, having that information, that enormous amount of work already done, enabled us to then go back and to add anesthesia and surgery exposure as a potential risk factor for the development of these problems. We did an initial analysis looking at learning disabilities. The current paper is an analysis of the same data set looking at ADHD as an outcome. And I'll confine my discussion to the ADHD results, although these are very similar to what we found for learning disabilities. What we found was that if you look at risk factors for the development of ADHD, if you had a single exposure to anesthesia and surgery prior to age 3, your risk for developing ADHD was no different than if you had not had anesthesia and surgery prior to age 3. However, if you had 2 or more exposures to anesthesia and surgery, your risk of developing ADHD more than doubled, even after controlling for the other factors that we know that are associated with ADHD. Now, it's very important to emphasize the limitations of this observational study, because this is a purely observational study. We controlled for as many factors as we had data for. We controlled for factors such as the severity of illness or the burden of illness in these children in the best way that we can. However, we still don't know whether this is something that anesthesia and surgery actually causes, or whether anesthesia and surgery is simply a marker for other conditions that may be responsible for this association. Clearly, children who have anesthesia and surgery are different in some ways than those who do not require anesthesia and surgery. And we can't exclude the fact that we've not picked up some confounding variables that might be responsible for this association. But what it does suggest is that at this point we simply can't exclude the possibility that exposure to anesthesia and surgery may be causing some problems with learning and behavior later in life. Might be the anesthesia, that might be confirmed by some of the animal data, certainly would be consistent with animal data. It might be the stress of surgery because, for example, we already know that stress and the stress response, if prolonged and severe, can cause later neurodevelopmental problems. So at this point, we're trying to not panic people because, again, we haven't proven anything. We haven't proven that anesthesia and surgery is a problem. And we certainly don't do these procedures in young children just for fun. We do procedures because they're necessary. So we're not wanting parents to have undue worry. We're not wanting parents to cancel necessary surgical procedures because of these findings. I have a 4-week-old granddaughter. Last week, she needed a general anesthetic for a serious illness. There was no question in my mind whether she should have the anesthetic. Absolutely necessary for her health. Do I think about it? I think about it. What it means is that we need to do more research. We need to have more understanding from the animal literature about what that potential mechanism of the effect might be, and if there's anything that we might do, say, with a pharmacologic treatment that might be able to prevent any of the problems that we might see. We need to do more human work. We need to have more observational studies like ours to confirm our results. We need to have experiments such as randomizing children to different types of anesthetics. And in fact, there is a trial going on right now of children who require inguinal herniorrhaphy at a young age, where they're randomized to either have a regional anesthetic or a general anesthetic. And then they will be compared later in life to see if they had any difference in any developmental problems. So there's a lot more work that needs to be done. The FDA has formed a group called Smart Tots to encourage and to fund this kind of research into the future. And if you're interested in this work, you can simply Google Smart Tots and see the website that's been set up to promote this kind of activity. At the moment, we are simply trying to reassure parents that, again, despite these results, we don't know whether anesthesia and surgery is actually causing these problems, that there's no evidence from our studies or any other human studies that a single exposure to anesthesia and surgery causes any problems at all, and that because in the vast majority of cases these surgical procedures are absolutely necessary for the health of these children, we don't want to discourage parents from having needed operations. But we do need to do more work. We do need to understand whether in fact this really is a problem, and if it is, what are the mechanisms so that hopefully we can do something to ameliorate it.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.